we have these three different types of invaders, and knowing which type is causing an infection is critical because it determines the kind of treatment that will be effective. Let's zoom in on the bacterial STIs, which are some of the most common infections out there. First on our list is chlamydia. It's incredibly widespread, partly because it's often a silent infection. This means many people who have it don't show any symptoms at all, so they can pass it on without even knowing they're infected. When symptoms do appear, they might include unusual discharge from the penis or vagina, or a burning sensation during urination. Next is gonorrhea, which is often mentioned in the same breath as chlamydia because they share many similarities. Also, like chlamydia, gonorrhea is curable with antibiotics. However, and this is a big however, some strains of gonorrhea have become resistant to antibiotics, making them much harder to treat. This is a growing concern in the medical community, and a powerful reminder of why prevention and early treatment are so important. Then there's syphilis, an older and more complex bacterial infection. Syphilis is sometimes called the Great Pretender because its symptoms can look like many other diseases. It typically progresses in stages. The first stage is usually a single painless sore called a chancre at the site of infection. If still left untreated, syphilis can enter a latent stage for years before progressing to the final, most severe stage, which can damage the brain, nerves, and other organs. The good news? If caught early, syphilis is completely curable with penicillin, a powerful antibiotic. The common thread with all these bacterial infections is that they are treatable and curable, but only if you know you have them. Their ability to hide without causing symptoms is what makes them so sneaky and allows them to spread so easily. Regular testing is the only way to be sure. Moving on from bacteria, let's talk about a common parasitic infection called trichomoniasis, or trich for short. This STI is caused by a tiny single-celled parasite. What's fascinating and also challenging is that about 70% of people with trichomoniasis don't have any signs or symptoms. When they do appear, they can range from mild irritation to severe inflammation. For women, this might mean itching, burning, or soreness of the genitals and a thin, often frothy discharge with an unusual smell. The fantastic news is that trich is easily cured with a single dose of a prescription antibiotic medication. Now let's shift gears to the world of viruses and talk about herpes. Herpes is caused by the herpes simplex virus, or HSV.